Half of children that are hospitalized with COVID-19 develop headaches and altered mental state or neurological symptoms. That in a report at Study Finds, where we invite you to like and subscribe to get the latest information. Researchers from the University of Pittsburgh also report COVID-19 positive pediatric patients with these symptoms were much more likely to need intensive care. Of the 44% of children with neurological symptoms, the most common were headaches and acute encephalopathy, or in simpler terms, an altered mental status. Lead study author Dr. Ericka Fink said the SARS-CoV-2 virus, quote, can cause acute disease where symptomatic illness comes on soon after infection. Or children may develop an inflammatory condition called MIS-C weeks after clearing the virus. MIS-C is characterized by organ dysfunction, a fever and inflammation, and usually develops weeks after recovering from COVID-19. Besides an altered mental state and headaches, seizures were the third most common neurological symptom among children with acute COVID-19. Regarding MIS-C, the most common neurological symptoms were headache, acute encephalopathy, and dizziness. While much more rare, other reported symptoms across both groups include stroke, loss of smell, psychosis, and vision issues. Researchers say thankfully mortality rates in kids are low, but the frequency of neurological manifestations are high. It's important to note that neurological symptoms were actually more frequent among pediatric MIS-C patients than those dealing with acute COVID-19. Similarly, kids with MIS-C were also more likely to develop at least two neurological symptoms. Study authors have already started work on a follow-up study aimed at assessing the long-term impact of both MIS-C and COVID-19 on recovered children. Find more details on this and other studies at studyfinds.com.